Point 1. Silent heart attacks, the deadliest warning you may never feel. Imagine a 74-year-old man named Rahim. He walks daily, smiles at his neighbors, and rarely complains about his health. One morning, he feels a bit tired and slightly dizzy but brushes it off. It's probably just the weather, he says to himself. By evening, he's gone, his heart silently stopped, without a single dramatic symptom. Silent heart attacks are one of the most dangerous killers of the elderly. Unlike the classic chest-gripping pain seen in movies, seniors often experience mild fatigue, nausea, jaw discomfort, or even confusion. These subtle signs are easily overlooked, especially if the person has diabetes or high blood pressure, which can mask pain. Doctors explain that aging causes changes in the nervous system, making the body less responsive to warning signs. Many older adults don't feel the intensity of a heart attack until it's too late. That's why annual heart screenings and listening to even minor bodily changes is not just advice, it's a life-saving habit. Narration suggestion. A calm elderly man walking slowly, occasionally pausing to catch his breath. A split screen showing a healthy heart and a blocked artery. Close-up of hands gripping a chest faintly, then a fade to black with a flat ECG line. Preventive advice, regular ECG and cholesterol testing. Understanding that unusual fatigue, sleep disturbances, or shoulder discomfort can be warning signs. Using smartwatches or heart rate monitors to detect abnormalities in rhythm. Managing stress, reducing salt intake. Point 2. And avoiding excessive caffeine. When a fever isn't just a fever, meet 79-year-old Amina. She complains of sudden confusion and loss of appetite. Her family assumes it's dementia progressing, but they're wrong. A hidden urinary tract infection (UTI) has spread to her bloodstream, causing sepsis, a silent killer among seniors. Older adults often show different signs of infection: no high fever, no clear pain. Just sudden tiredness, confusion, or a general off feeling. This makes infections in seniors deadlier and harder to detect. According to geriatric doctors, aging immune systems react slower. A simple cold or urinary infection can spiral into sepsis or pneumonia if not treated immediately. The problem is, most seniors or caregivers delay hospital visits, assuming it's nothing serious. Narration suggestion. An elderly woman sitting in a chair, staring blankly at the wall. Medical visualization of bacteria spreading through the bloodstream. A worried family member calling for help while monitoring temperature. Preventive advice. Watch for confusion, increased falls, or new incontinence as red flags. Regular hydration and proper hygiene, early treatment of minor infections. Caregivers must trust their gut. Sudden behavioral changes often mean more than meets the eye. Point 3. Dangerous falls, the fastest path from independence to mortality. Visualize this. 81-year-old Mr. Shaw steps onto a slippery bathroom floor. His foot slides, his body twists, and he crashes down. What seems like a simple hip fracture leads to bed rest, pneumonia, and eventually death. Falls are the #1 cause of accidental death in people over 65, but they're not just accidents, they're often preventable. Poor lighting, cluttered floors, rugs, dizziness due to medication, or poor footwear all add to the risk. One fall can trigger a chain reaction: hospital stay, surgery, immobility, infections, depression, death. Seniors often don't bounce back from a serious fall because their bones heal slowly and immune systems weaken rapidly. Narration suggestion. A clean, bright bathroom contrasted with a dark one with a slippery floor. An animation showing how a fall affects the spine or hip. Slow motion of a hand reaching out but not catching the edge in time. Preventive advice. Use grab bars, anti-slip mats, and good lighting. Review medications with a doctor for dizziness. Regular eye checks and vitamin D supplements. Encourage balance-building exercises like Tai Chi or chair yoga. Point 4. Undiagnosed high blood pressure, the silent destroyer of organs. 74-year-old Parveen has no symptoms. She lives peacefully, drinks herbal tea, and avoids sugar. But inside her body, her blood vessels are under pressure, too much pressure. She suddenly collapses from a stroke during an afternoon nap. High blood pressure, also known as the silent killer, causes more sudden deaths in elderly adults than most other conditions. It can lead to stroke, heart failure, kidney damage, and even vision loss, all without any visible symptoms until it's too late. Many older adults skip monitoring their blood pressure because they feel fine, but feeling okay doesn't mean your arteries are safe. This false sense of wellness delays diagnosis and allows the damage to build quietly over years. Narration suggestion. Slow zoom into the heart pumping harder than necessary. An elderly woman calmly drinking tea while her internal organs slowly change color, symbolizing stress. A sudden shift to emergency responders taking vitals. Preventive advice. Home blood pressure machines are essential. Limit salt, processed foods, and caffeine. Monitor stress levels. Emotional health affects blood pressure too. Annual full physical checkups with kidney and eye function included. Point 5. Medication mismanagement, the unseen poison in the pillbox. 85-year-old Irfan takes 9 different medications. Some are for his heart, others for sleep, pain, digestion, and anxiety. But one day, he feels dizzy, falls, and is rushed to the hospital. Doctors discover that 2 of his medications had dangerous interactions. Polypharmacy, the use of multiple medications, is a huge but overlooked cause of sudden death in seniors. As metabolism slows with age, the body processes drugs differently. Side effects become stronger. Confusion, falls, internal bleeding, and organ failure can result. Even worse, many elderly people forget doses or accidentally double them. Some combine herbal remedies without telling their doctors. This cocktail of drugs turns what should be healing into a dangerous gamble. Narration suggestion. An elderly man opening a pillbox with too many compartments. Visualization of pills entering the bloodstream and causing disruption. Doctor consulting a confused patient with prescription slips falling like snow. Preventive advice. Simplify medications review every 6 months. Use labeled pill organizers with alarms. One primary doctor should oversee all prescriptions. Be honest about over-the-counter and herbal usage. 6. Undiagnosed heart arrhythmias. Many elderly people feel the occasional flutter in their chest or a skipped heartbeat. Often, they dismiss it as anxiety or indigestion. But in many cases, this seemingly harmless symptom could point to a serious heart rhythm disorder like atrial fibrillation. A fib increases the risk of stroke 5-fold. What makes this deadly is its quiet nature. People live with it unknowingly. By the time they seek help, they may already be facing life-threatening complications. Seniors must regularly monitor their pulse, undergo ECGs, and never ignore palpitations or dizziness. 7. Silent infections, especially UTIs and pneumonia. In seniors, infections don't always come with fever or obvious pain. A urinary tract infection may show up as confusion or sudden weakness. Pneumonia may just feel like a loss of energy. These silent infections progress quickly in aging bodies. Left untreated, they can lead to sepsis, a dangerous body-wide inflammation that can result in death within hours. Recognizing subtle symptoms like mental fog, fatigue, or a slight cough is critical. Family and caregivers must stay alert to even small changes. 8. Blood clots, deep vein thrombosis, and pulmonary embolism. Long periods of inactivity, especially after surgery or travel, can trigger blood clots in the legs. When a clot travels to the lungs, it causes a pulmonary embolism, a condition that can kill within minutes. Seniors must stay active, wear compression stockings when needed, and stay hydrated. Leg pain, swelling, or chest pain with shortness of breath are all red flags. One senior citizen who ignored minor calf pain while recovering from knee surgery died suddenly just 2 days later, highlighting the urgency of this issue. 9. Sudden drop in blood pressure, postural hypotension. Imagine waking up and standing from your bed, and the next moment, you're on the floor, unconscious. That's how sudden a blood pressure drop can be in seniors. Known as postural or orthostatic hypotension, it can result from dehydration, medications, or neurological issues. Falls due to hypotension can lead to fatal head injuries or internal bleeding. Seniors must rise slowly, stay hydrated, and have their medications regularly reviewed. Diabetes crashes, hypoglycemia. Many elderly people manage diabetes, but the danger often lies not in high sugar, but dangerously low sugar levels. Skipping a meal, taking too much insulin, or even a minor infection can lead to hypoglycemia. When the brain is deprived of glucose, unconsciousness and death can quickly follow. The elderly should always carry glucose tablets, monitor levels closely, and avoid fasting without supervision. 11. Medication mismanagement and polypharmacy. As we age, our medicine cabinets grow more crowded. Blood thinners, cholesterol pills, sleeping aids, antacids, the list goes on. Taking multiple medications without proper guidance can result in deadly drug interactions or organ failure. For example, mixing certain diuretics with an SAIDs can cause sudden kidney shutdown. Seniors should regularly review their medications with a pharmacist or geriatric physician, and caregivers must track adherence and symptoms. 12. Emotional isolation and mental health neglect. Loneliness isn't just sad, it's deadly. Seniors who feel disconnected are at higher risk for stroke, heart disease, and early death. Emotional pain often turns physical: poor appetite, disrupted sleep, and weakened immunity. One widow in her late 70s, who lost to close friends within months, quietly stopped eating and died within a year, never once complaining. Mental wellness checkups and regular companionship are not luxuries, they're lifelines. 13. Undiagnosed sleep apnea. Snoring might seem like a harmless annoyance, but in the elderly, obstructive sleep apnea can cause oxygen levels to plummet during sleep, leading to heart strain, high blood pressure, and even sudden cardiac death. Many seniors go undiagnosed because they live alone or think poor sleep is normal with aging. Sleep studies and CPAP therapy can be life-saving. If a senior wakes up gasping, feels unrefreshed, or snores loudly, it's time to investigate. 14. Unrecognized dehydration. Adults often don't feel thirst the same way younger people do. As a result, they drink less, especially when it's cold or they're on diuretics. Dehydration causes confusion, kidney failure, and shock. One simple tip: check the color of urine, it should be pale. Caregivers should encourage fluid intake with soups, fruit, and water-rich vegetables. Fatal dehydration can set in over just 2-3 days. 15. Uncontrolled high blood pressure. The silent killer. It's called the silent killer for a reason. High blood pressure damages blood vessels slowly until one day a vessel bursts in the brain or a clot blocks a vital artery. Stroke and heart attack are two leading causes of death in seniors, and both are preventable. Home monitoring, salt reduction, and light exercise can make a huge difference. Seniors should never stop medications abruptly and must treat blood pressure with the seriousness it deserves.